best of times, it was the worst of times. Free healthcare was available to all in Canada, but wait times made access an issue. When you compare Canada against other developed countries, we have some of the longest wait times. The median wait time is 8.8 hours, and unfortunately, 10% of people will have to wait over 27 hours to be admitted. That's more than a day spent waiting for a bed. We call a problem like this wicked. The wait times in Canadian emergency rooms is a problem that is incredibly complex, with many possible solutions that have been implemented in the attempt to fix it. Despite this, the problem persists. This video will introduce new strategies that will help to improve wait times for all. The end result is to improve efficiency of patient flow and patient satisfaction. Before coming to a decision on what should be done to combat emergency room wait times, it is important to understand the environment inside and outside the department influences these times. These include an increased demand for services, shortages or inadequate resources such as staff and materials, inappropriate triaging, and lack of access to primary care in the community. Although this issue needs to be addressed, it is also important to recognize that not everyone's wait time should be equal. Those in need for attention for urgent medical conditions should be seen immediately, whereas those in a more stable condition with less serious medical problems should have to wait. To determine the order that physicians should see patients, triage nurses use the Canadian Triage and Acuity Scale. The scale relies heavily on the nurse's judgment and what the patient reveals during assessments. Some strategies that have been used in the past to decrease wait times has been to advertise wait times electronically, either through a texting service or on a website, which allows for patients to decide which hospital to visit, thereby affecting traffic and patient flow. Our recommendations to try and reduce wait times rely on a three-pronged approach. The first strategy is to post the emergency room wait times on the hospital's social media accounts, its website, or through a texting program. This strategy allows a person to decide which hospital they want to go to based on the wait time. It also gives a person a realistic expectation for the amount of time they might have to wait. The second strategy is to provide information about alternative places to go in order to receive care. The hospital's website could list a number of other healthcare providers in the area. These could include walk-in clinics, nurse practitioner and family doctor's offices, and urgent care clinics. This strategy has the potential to improve emergency room wait times. In a survey done by an Ontario hospital, 93% of people coming into the emergency room have a family doctor, and 75% of them were visiting during the doctor's hours. The third and final strategy is to apply the Toyota production system, also known as the Lean system. The goal of this system is to standardize work in order to eliminate the wasteful steps in the process. In practice, patients come directly into the emergency room, are triaged, and seen by a doctor in the order that they arrive. After seeing the physician, depending on their triage level, they will go for tests, receive care from a nurse or a doctor, or wait. This strategy hopes to improve patient satisfaction because a doctor sees them right away and a treatment plan is established. In a hospital in Ontario where the strategy has already been implemented, it has reduced the wait time by approximately 30%. By implementing this three-pronged approach, Canadian hospitals would see short-term and long-term benefits. The online component would only take a week or two to get up and running and would increase patient satisfaction and give them other options for care in the community. The Lean system would take longer to implement due to healthcare worker training and the resources and time needed to set everything up. Despite this, it would be the most effective to improve wait times on a long-term basis. By following these strategies, we can begin to combat the wicked problem of long wait times in Canadian emergency rooms, thereby improving the benefits of healthcare for all Canadians.